Hello and welcome to another episode of What's the Diagnosis? Slightly different today in that I've already looked at this slide. I was going through it as part of my training for my exams in February, and I thought it was a really nice slide, mainly because I got the answer completely wrong. So what we can see here is a section of tissue from a swan. Again, this slide is from the Joint Pathology Committee's Wednesday slide conference collection, and is available online through their website. We can identify the organ, its heart muscle, and perhaps that will become more apparent as we zoom in a bit closer, but just scanning around on low power, we can already start to see some abnormalities, mainly these areas of inflammation here that are disrupting the heart muscle, and many of you will have already spotted there's something odd here, some structures kind of interrupting the heart muscle. They don't really look like swan tissue. Not sure if this is one down here as well. No, I think that's just another bit of inflammation. Okay, so I got completely distracted by these because they're quite stunning. There was a better section of one just over here in like a perfect transverse. So this is an adult nematode. We can see that it has a cuticle around the outside, this thin layer here, and if you want to know more about nematode anatomy, I have another video of that, so you can go and check that out at the end of this video. And then there's a layer of muscle here. They have what's called a pseudocoelom, so it's not a true body cavity like we have a thoracic cavity or an abdominal cavity, in that yes, there's some space here, but it's not lined by cells, so it doesn't count as a true body cavity. It's a pseudocoelom. We have a gastrointestinal tract here with bubbly uninucleate cells, and then most of the pseudocoelom is dedicated to reproductive tract. So this is a female nematode, in that these are presumably eggs, and then in here all of these are larvae, so the first life stage, still within the eggs, within the uterus of the adult female. And if we look at kind of what's going on around in the heart muscle of this swan, yeah, there's some inflammation around here, but the nematode itself seems to be within a capsule, so it's kind of walled off from the rest of the body. We'll go and have a little look at some of the other ones that were around the place. Oop. So here's another one. So this one's a lot more clear that it's not really causing any inflammation in the heart. It just transitions directly from nematode to normal heart muscle. So you could start to question whether or not these are actually causing the main problem and could be the cause of death in this swan. Here's another section, probably a little bit higher up in the nematode body, because we don't have any reproductive tract. There's maybe the esophagus here, and I'm pretty sure these are lateral cords, and again you can find out more about those in the video on nematode anatomy. I thought that the problem with the swan was the presence of the nematodes, but when I went back and read the answers, I guess, turns out that they weren't the cause, and that actually there are further bits of inflammation within the heart muscle. So we'll have a little look at those. We can just see the heart muscle here being completely replaced by inflammation. We've got some red blood cells here. So birds have nucleated red blood cells, which can be a bit confusing to look at. Sometimes you think that something exciting is going on, but it's actually just a blood vessel. And the heart muscle has been replaced by lots of macrophages, so these big potato nuclei, There are some lymphocytes, and with lymphocytes you inevitably get some plasma cells like this one here. There's necrosis of the heart muscle, so the heart muscle cells are dying. Here's some heart muscle cells that have lost their striations. They're much bigger, they're kind of falling apart compared to this nice normal heart muscle here, where you can see the lovely striations in the cytoplasm and kind of crisp, clear edges to the cells. And I actually found some lovely, I'll just go and find it. Oh, here it is, it wasn't that far away. So here you can see a heart muscle cell. It's really expanded compared to the normal ones. The nuclei are swollen, they've lost their striations. This one here is in the later stages of necrosis. You can see its nucleus is kind of starting to fall to bits. And then if we scan around, I did find some early stages of this necrotic lesion. Here we go. So here this bit is just starting to go downhill, and that you can tell there's a color change here between the normal heart muscle, and this bit's a lot paler because the cells are starting to swell up. Look at this, nucleus is starting to swell up, and actually these cells have been infected by a virus, the highly pathogenic avian influenza virus. So avian influenza has two forms: a low pathogenicity form, which infects the respiratory tract, but sometimes you get mutations in a protein on the virus that allows it to go nuclear and systemically, and it starts infecting all kinds of cells, including heart muscle cells. So these heart muscle cells have probably been infected by the highly pathogenic avian influenza virus. Their nuclei have swollen up, their cytoplasm has started to swell as well, and they've lost their striations, so they've lost their functionality, they can't contract anymore. And as the cells start to die, they begin to attract the inflammatory infiltrate. So we've already got some macrophages here with golden brown hemosiderin in them, because they've been starting to eat some of the red blood cells that have leaked out of the blood vessels. So I think when they found the swan, the contributors said that the swan was not dead, but it was sick enough to be caught and then euthanized, and a kind of riverside diagnostic test tested positive for avian influenza. So surprisingly, the cause of death in the swan was not the presence of worms within its heart, although they probably can't be helping the situation, but actually infection with a highly pathogenic avian influenza virus. So I hope that was an interesting look at some heart muscle from a swan, where the answer wasn't immediately obvious, or there was a distraction in the slide. And as I said before, if you want to find out more about nematode anatomy, there should be a little box for you to click on the video about adult nematode anatomy. So thanks for watching, and until next time, goodbye.